Welcome back to From Fear to Fun, the podcast where we explore how to transform medical encounters with children from moments of fear into opportunities for fun, with connection, confidence, and cooperation. I'm so glad that you are here. Today's episode focuses on one frequently misunderstood aspect of pediatric communication. Pre-verbal children are not heard, they are seen. We often assume communication is primarily verbal, but children, especially pre-verbal or non-verbal ones, speak a different language altogether. And if we don't learn to listen with our eyes, we miss their voice entirely. In my consultation room, young children are often quiet. Not because they have nothing to say, but because the environment intimidates them. Silence does not equal disengagement. Silence does not equal consent. And silence does not equal cooperation. As Jane Magagna describes in The Silent Child, children may be verbally silent, but screaming non-verbally. Their communication is happening, just not through words. When a pre-verbal child is present, many healthcare professionals instinctively shift their attention to the parents to gather the history, to explain the plan, to keep the process efficient. Meanwhile, the child becomes passively handled, restrained when needed, examined without explanation, and expected to just keep quiet. But imagine treating an adult this way: no permission, no explanation, no regard for boundaries, physical restraint to get things done. We would call this disrespectful, even abusive. For a child, it can feel like a torture, and this is why the examination room can feel like a dungeon. The alternative is here to listen with our eyes. Pre-verbal children do speak. Their vocabulary is posture, muscle tension, head orientation, gaze, breathe, stillness, movement, proximity, withdrawal. And these signals tell us, I'm curious, I'm scared, I'm overwhelmed, I'm ready, I want to run away, I can cooperate. The younger the child, the more honest their body language. They don't mask, they don't pretend, they don't lie. Their whole body reveals their mind. So now the task becomes ours to balance leadership and listening. We still need to lead the consultation, we still need to examine, we still need to treat. But we can do this while honoring the child's non-verbal voice. This means pausing when the child turns away, slowing down when their body stiffens, acknowledging fear when their eyes widen, inviting cooperation when their posture opens, giving space when they withdraw, offering comfort when they seek proximity. We maintain charge, but we also maintain respect. Why does this matter? When we ignore a child's nonverbal communication, trust erodes, fear increases, cooperation collapses, procedures become traumatic, parents become anxious, and the consultation becomes harder for everyone. When we see the child, trust grows, fear decreases, cooperation improves, the child feels respected, the parent feels reassured, and the consultation becomes smoother, safer, and more humane. This is the heart of child-centered care. In a nutshell, pre-verbal children communicate constantly, just not with words. Their body language is honest, clear, and expressive. Ignoring their nonverbal voice leads to fear and resistance. Listening with your eyes allows us to understand their needs. Respecting their signals transforms the consultation into a cooperative encounter. To hear a pre-verbal child, we must be all eyes, not only all ears. Thanks for listening to From Fear to Fun. Next time we will look at the conflicting needs regarding timing, where we want to set the pace but are slowed down by the parents and the pediatric patients. Until then, remain curious, offer connection, and keep moving from fear to fun.